this video, let's discuss about cellular adaptations. There are four types of cellular adaptations, which are atrophy, hypertrophy, hyperplasia, and metaplasia. Atrophy is defined as a reduction in the size of an organ or tissue due to decrease in cell size and number. The mechanism of atrophy is due to three things: decrease in protein synthesis, increase in protein degradation, and increase in autophagy. Decrease of protein synthesis is due to cells making fewer proteins. It happens due to decreased workload, decreased blood supply, decreased nutrition, decreased hormonal production, which results in reduction of metabolic activity and the cell becomes smaller due to increased protein degradation. The body breaks down proteins faster using ubiquitin proteasome pathway. Damaged or unwanted proteins are tagged with ubiquitin, and these are sent to proteasome where they are destroyed, resulting in loss of structural proteins of the cell, ultimately leading to the shrinkage of the cell. In autophagy, which is nothing but self-eating, the cell eats its own organelles in the autophagic vacuoles that are formed in the cell due to starvation or nutrition deficiency, which results in decrease of cell size. This is how a normal muscle would look, and you can compare it with an atrophied muscle. Coming to hypertrophy, so you can see a normal uterus and compare it with a hypertrophic uterus. Hypertrophy refers to an increase in size of cell that results in increase in the size of an affected organ. The mechanism of hypertrophy is as follows. There is increased demand and hormonal stimulation, which happens because of conditions like exercise, where there is increased mechanical load or excess hormone production, because of which the mechanical and chemical signals like pressure and growth factors stimulate the cell. The signal transduction pathways are activated, which in turn will cause gene activation, resulting in more protein and organelle synthesis, and there will be increased in cell size, which we call as hypertrophy. Now, hypertrophy is an adaptive function which increases strength and functional capacity. But if the stress persists, there will be increased energy demand than energy supply, which causes energy deficit, causing cell injury and ultimately organ failure. Hyperplasia is defined as increase in number of cells in an organ or tissue in response to stimulus. There are two types of hyperplasia: physiological hyperplasia and pathological hyperplasia. The examples of physiological hyperplasia are proliferation of a glandular epithelium of female breast and compensatory regeneration of the liver. Examples for pathological hyperplasia are endometrial hyperplasia. Hyperplasia is due to increase in functional demand, which will cause stimulation of growth factors, ultimately resulting in increasing of number of cells. Metaplasia is replacement of one differentiated cell type by another differentiated cell type. So the best example for metaplasia is Barrett's esophagus, in which normal squamous epithelium of esophagus is replaced by columnar epithelium because of chronic irritation caused due to acid reflux. So it's a protective mechanism to stress. The other types of metaplasia are squamous metaplasia, which is the most common form of metaplasia, usually seen in bronchial epithelium of chronic smokers. Barrett's esophagus is an example of intestinal metaplasia. And there is osseous metaplasia, where bone is formed in non-skeletal tissues. So this bone formation is seen in old scars or tumors. And there is oncocytic metaplasia. Oncocytes are cells rich in mitochondria, and they have granular eosinophilic cytoplasm. Oncocytic metaplasia is usually seen in Hashimoto's thyroiditis, where the oncocytic cells are known as Hurther cells. Thank you. For more such videos, subscribe to Tissue Doctor channel on YouTube.